Hello everyone, welcome to the Nurses Heartbeat. My name is Philip and I'm a nurse by background. And today episode of the podcast we are looking at the silent killer. I am going to give you what you need to know about hypertension, why it is called the silent killer in the first place, and some shocking statistics that you need to know about this condition. This is where you have to be to get the expert advice about your health, about your well being. Join me and let's do it now. Hypertension, we've heard so many people talking about hypertension, what we normally call high blood pressure. Now, what is hypertension? Previously, I used to think that high blood pressure means that you have high blood in your body. So you have more blood in your body, and that is why it is giving you the pressure. But that is not so. It goes beyond that. All right. So, simple terms, how you know you have blood pressure. So, it happens when your blood pressure is persistently above 140 over 90 millimeters of mercury. So, people go to the hospitals and to the health facilities and they check their blood pressure. Now, on several occasions, when your blood pressure is above 140 over 90, then you are getting hypertension. It is not just one off because there are so many situations that will make your blood pressure go high, probably one off condition, but this is when it is persistently higher. Now, ideally, when you do your blood pressure for an average normal human being, your blood pressure should be around 120 over 80. There are a few exceptions because some people normally have a low blood pressure as their baseline and they may have maybe 110 over 80, which is normal. But the average accepted value for blood pressure is 120 over 80. And then when your blood pressure is elevated, then you'll be going like 130, 135 over 80 over 85, 88 there. But when you do your observation, you check your vital signs, you check your blood pressure in a simple man's term. So you check your blood pressure, and for several times it is more than 140, then you are having hypertension. That is how it is diagnosed. All right. Now, hypertension is often called the silent killer. Why? Because there are no symptoms until it gets serious damage or serious consequences in the body. There are so many people that are living with hypertension. They do not know at all. Why? Because they are not having any sign, no symptoms of hypertension. By the time they realize or they are diagnosed hypertension, it would have gone too far to have affected various organs of the body. Now, organs of the body that can be affected by hypertension, we are talking of your heart. So when you have hypertension, your heart will be affected, your arteries and your kidneys and your brains can all be affected because the pressure of the blood that is moving through the vessels, going through your brain, going through your heart, going through your kidneys, these are the core organs of the body, is so high that it can easily cause damage to you. Now, let me give you some mind-blowing statistics about hypertension that you need to know. So, according to World Health Organization 2023, 1.28 billion adults in the age between 30 to 79 worldwide have hypertension. So all the people in this world, 1.28 million billion of the people have hypertension. That is so huge. All right. And then 46% of adults with hypertension don't know they have it. That is almost half. So when you take 10 people that are having hypertension, At least four people want to know they have hypertension, but they have it, they have the condition, and that is what makes it so serious, and that is why we call it the silent killer. Now, less than 1 in 5 adults with hypertension have it under control. So when you think 5 people that are having hypertension, less than one or only one of these people are able to manage the hypertension. Though that is serious. So you have 5 people, and 4 of the people do not know how to manage their condition, which is so deadly and can kill you without knowing. Many a times we hear people pass away, and we just say, oh, we met them 2 days ago, we met them last week, and they didn't have any sickness, they were not ill. How come these people are dead? Most of these deaths are as a result of hypertension, and that is how serious it is. Now, hypertension is a major contributor to heart attack. So people have arrest, they fall off, they fall down, and they will not wake up again. That is hypertension. It is a major contributor for people having heart attacks. Stroke, there is rampant increase of stroke conditions, and the major contributor of this condition is hypertension. Kidney failures, hypertension is contributing to a lot of kidney failures. Young people, elderly people are having kidney conditions. People are being on dialysis, which is so expensive. The contributing factor of most kidney conditions is hypertension. And then early death. As I've said, many people are dying because of hypertension, and 4 out of 10 people do not know they have the hypertension. That is how serious it is. Now, in many countries, hypertension causes more deaths than any other preventable conditions. So there are so many countries that conditions that could have been prevented, or conditions that could have been managed properly, the leading death of all these conditions is hypertension. Because if you don't know you have hypertension, how do you manage it? And how do you prevent yourself from getting the hypertension in the first place? That will bring us to the causes or the risk factors of hypertension. Let's look at that now. When I talk of risk factors, I am talking about conditions that predispose someone to getting hypertension, or the ways or the means that will make somebody contract hypertension. That is the risk factors. Now we have the modifiable risk factors or the controllable risk factors. They are risk factors you can do something about, and we have the risk factors that you cannot do anything about it. And more of the time, we are so much concerned about the controllable risk factors or the modifiable ones, because that one you can work on it. All right. So let's look at the controllable risk factors of hypertension. High salt intake means people that likes a lot of salt in their diet are predisposing themselves to getting hypertension. Poor diet. There are people that they eat anything that they get, junk foods, foods that have high cholesterol in it. They just want to feel good. They want to make sure that it is tasty in their mouth, and they eat all these junk foods. Poor diet. Poor diet is a diet that is not balanced. We have balanced diet that has all the food nutrients in it. People are not eating that. They want junk food, fast foods that are poor diets. They can already predispose you to getting hypertension. Obesity. People are becoming fat, they are becoming obese in some many parts of the country or of the world. People, when they grow fat or when they become obese, it's a sign that they are having money or they are living a good life. But look, becoming big, becoming obese can have so many effects on your health, and one of them is hypertension. It can easily predispose you to getting hypertension. We also have lack of exercise. Now there is sedentary lifestyle. People are driving in the best of cars. They don't have time to exercise. They don't even walk. They are in their cars every now and then. They are not walking. They are not riding bicycle. They are not exercising. Lack of exercise can predispose you to having hypertension. Smoking in this Western world, it is so rampant. Everywhere you go, people are smoking. Even in the hospital environment, you see smokers. Smoking is a very big predisposing factor to getting hypertension. And if you want to stay away from getting hypertension, then you need to put a stop to all of them. Alcohol. Many people are taking alcohol. It makes them feel good. They are enjoying themselves. When they are happy, it is alcohol. When they are sad, it is alcohol. It can predispose you to hypertension. And stress, too much stress. There are some people, when they stress, they are eating a lot, and when they eat, they are putting on weight. They are becoming obese. They can get hypertension. People that are stressed, they don't consider what food they are eating, and then they eat poor food and they can get hypertension. People that are so much stressed can have a lot of emotional and psychological pressures. All right, and all these things can have effects of you and can predispose you to getting condition hypertension. So these are the controllable things. These are the things you can work on it. So if it is about high sodium intake, high salt intake, you have to reduce the amount of salt that you take in your diet. Make it as low as possible so you don't predispose yourself from getting hypertension. Obesity, you have to know the food you are eating, reduce junk food, reduce fast food, eat good food, reduce eating poor food. All right, and then have a lot of exercise, avoid smoking, avoid taking alcohol, and then don't expose yourself to too much stress. Have stress management plan in place to handle your stress, and this is going to help you. And then the uncontrollable risk factors, these are the things that you don't have control over it. We talk of age. Hypertension increases with age. So when you are 40 years and you are going up, then you are being predisposed to hypertension. So age, family history, there are some people that their families, in their families, they have hypertension. Okay, so it's quite likely you could also have that as well. Ethnicity, there are some tribes and ethnic groups that they are more um, preview, or they are more prone to getting hypertension than others. And then other health conditions like people with diabetes, people with kidney diseases, it's quite likely for them to get hypertension as well. These are things that is difficult because you cannot do anything about them, and that you there is nothing you can do. But the controllable ones, do your best and stay away from these things that will predispose you to getting hypertension. In the next episode, I will give you the signs and the symptoms. How will you identify? How will you know that you have hypertension? What do you have to know? What do you have to do? How is it managed? And any other thing that you need to know about hypertension. Thank you for listening to this video to the end. If you liked it, I want you to subscribe and share. My name is Philip once again. Remember, every heartbeat matters. See you in the next episode. Bye.